Hey crew, what's up? It's Dr. Jared here at Health and Performance Center. We're going to talk on a Now You Know segment again, and specifically we'll talk about femoral acetabular impingement. Wow, that sounds like a mouthful. FAI for short. Some of you might have heard of this as CAM or Pincer impingement. What it is just pain on the front part of the hip associated with kind of that seated position or doing crisscross applesauce type position. You run into pain on the front or inside part of the hip. We'll give you a little bit more information on this. So what is this? Now we see a hip joint right in through here with pincer impingement. You'll see that the thing called the acetabulum, or it's actually this hip component, or excuse me, pelvic component of the hip joint itself is just too big. It wraps around too much, and it creates a pinching effect when the femoral head or the leg bone kind of moves around as you sit and stand, and it creates a pinch effect, bone on bone, that hurts. Now, if you go over and look at CAM impingement, that's more of an abnormality of the femoral head itself, meaning, hey, there's something going on here, something that's not supposed to be there on the femur itself, that when we go through those ranges of motion, we end up kind of going bone on bone again, and it hurts. So the idea with this is kind of start to understand, well, if I have any of these, am I doomed? And realistically, the answer is no. No, you're not. Now, some of these get so extensive that, yes, we do need to have a surgical intervention or manage that with corticosteroids. I've had some patients who have had that, who've had cysts in the femoral head. So if you do some things with your hip pain that aren't working or aren't quite getting the job done, it is important to get some sort of imaging to know exactly what is going on there. But that said, just like disc herniations, just because you have this doesn't mean you have pain. In fact, there are a lot of studies out there that show that just because you have a pincer impingement or a CAM impingement or CAM findings, we'll say, doesn't necessarily mean you feel the effects of that. And a lot of people are going through full range of motion and able to squat. So the FAIfix.com, that was sent to me by a patient of mine who had this, and I talked him into squatting and deadlifting and working through it. And now he just said, hey doc, I did a 310 pound for 10 reps deadlift the other day, and I feel fantastic. So just because you have this doesn't mean it's a death sentence, or even that you have to go in and have a surgical procedure. What can be done then? Well, it's really just starting to open up the hip joint itself and ensure there's full, uninhibited range of motion. A lot of times, if we see in this top picture, we start to do things that open up the hip in terms of flexion and external rotation. If we open up the hip in terms of extension and internal rotation, like we are doing here on this on the left image on the left, we're able to create better range of motion for the hip to roll and glide within the socket. Let's not forget how adaptive we are as human beings. We are very hard to kill. We are very hard to stop. And our hip joint is no exception. Just because we have some abnormality there doesn't mean we can't do some conservative things that either drastically improve the hip's capability or completely resolves the issue altogether. Now, these are just two images, but we have a lot of things in terms of adjusting the pelvis, adjusting the hip, adjusting the lumbar spine, creating balance and symmetry from the feet all the way up that can work wonders in terms of taking not only care of the hip, but of the knee and the foot, as well as the low back and all the way up into the head and shoulders as well. So just realize if you're having some of these issues, the FAIfix.com is a great place to go to get some generalized information. But if you want an expert hand and some guidance and a full approach to restoring your hip range of motion and capability, we are here to deliver on that end. Good luck. Hope this helps.